Alright, here's my student ID, my note cards, and visual aid, and then my audience. Hi, I'm Samantha Needham, and today I'm going to be talking about the importance of wearing a face covering during COVID-19. As a student, member of the workforce, and human being in general, I have been severely affected by COVID-19. Even those in good health have suffered at the hands of this virus, whether it be mild or fatal. In a constantly updated article by The Guardian, they stated that 10.1 million cases are currently active around the globe. People have lost close friends and family or know people who have won the uphill battle. Today I'll be talking about what COVID-19 is, how it spreads, and how important face masks are to prevent infection. Johns Hopkins stated that COVID-19 is a disease caused by a coronavirus that can cause symptoms such as fever, cough, shortness of breath, and loss of taste or smell. Symptoms vary from person to person as well as in severity. Some have needed to seek medical attention and can only breathe through a ventilator, while others have been able to stay home and treat it as they would the flu. There is no vaccine, but experts say that you can treat it through rest and fluids and with fever-reducing medications such as acetaminophen and ibuprofen. Now that you know what COVID-19 is, I'd like to talk about how it spreads. COVID-19 spreads through the air in droplets from sneezes or coughs. The first case appeared in Wuhan, China in December of 2019. People believe that a seafood market is to blame after multiple people caught pneumonia after visiting, and it was related to the coronavirus. Johns Hopkins recommends physical distancing of at least 6 feet as one precaution to help prevent the virus. Symptoms usually begin to show in about 14 days after exposure to the virus, and the CDC recommends that you seek medical attention if you have trouble breathing, persistent chest pain, or an inability to stay awake. Knowing how COVID-19 spreads, it's important to follow instructions to prevent it. There are many precautions such as social distancing, washing your hands, and disinfecting surfaces frequently. One of the most important, however, is wearing a face mask. Face masks, in addition to the rest of the procedures, are important to help prevent the spread of coronavirus. They help to filter air so as to not inhale large droplets from sneezes or coughs that would help encourage you to get sick. George Rutherford, an epidemiologist at UC San Francisco, said that you should always wear a face mask and social distance. The Department of Microbiology at the University of Hong Kong conducted a study on hamsters where they realized that the risk of infection reduced 75% when masks were worn. Dae Kai, a computer scientist at UC Berkeley as well as the University of Hong Kong, stated that if 80% of the population wore a mask, the infection rates would drop to 1/12 of what they are now. In this visual, you can see that a COVID-19 carrier without wearing a mask, as well as a healthy person without wearing a mask, has a high probability of transferring the virus. This one shows a carrier without a mask has a lower transmission probability of going to someone with one. And then 2 people wearing a mask, a carrier and a healthy person, has the lowest probability of transmitting the disease. During this speech, I explained what COVID-19 is, how it spreads, and how a face mask is one of the biggest ways that you can prevent contracting the virus. I hope that after hearing this, you better understand the risks of infection, how masks can help keep you safe, and how COVID-19 is a dangerous disease and that masks can help reduce the spread and help save lives. I hope that you will carry the information I've given with you and wear a mask to keep yourself and the population safe. Thank you for listening.